Chapter 8: Problems with structuring the therapy session is about the complications that a therapist has before, during, and after they have a therapy session. It is about their difficulties that they have about structuring the concepts that they want to fulfill for their patient in the session. It is about being aware of the problems and trying to find a solution so that you, as a therapist, can help your client. The therapist should monitor themselves and the patient and focus on the elements that play a part in the therapy session. The therapist should be aware of what is working and what is not benefiting the patient. This chapter is about the different elements that can improve the therapy session. If the therapist is aware and is focused on bettering the client, then these techniques will be beneficial. The therapist has to work on many things, but the three main things while in the therapy session are interrupting the patient, socializing the patient, and engaging the patient. These three things are crucial if the therapist wants to better their session and learn more about their patient. An element that is used to help the patient and is used for the therapist to understand the patient more is interrupting the patient. If the therapist is unclear about the topic, the therapist should interrupt the patient to get a better understanding on the situation. If the patient is going in multiple directions with their conversation, the therapist should interrupt them to have the patient get back on track. In some cases, patients express a very detailed summary of the previous week between last session and this session. This kind of update can take a long time, and there can be an underlying factor that is contributing to this behavior. Gentle interruption is the most effective. If the therapist is gentle and is caring when they interrupt their patient, then the therapy session and the relationship can be strengthened. The therapist should be checking how the patient reacts to the interruption. If the patient is not okay with the interruption, the therapist should ask questions on how the patient feels about the experience. The therapist should also ask the patient their automatic thoughts. The therapist can give their opinion on why they think the client is responding the way that they are, but only if the therapist has asked them questions and the patient does not respond. Positive reinforcement can also be a factor for the therapist to express to the patient. The therapist can express that they are thankful for the feedback and they can improve their technique while expressing to the patient that they will let the patient speak and they will have the patient clarify when they are finished speaking if they have any other questions. Apologizing and pointing out that you as a therapist have done something that has offended them and can make them appreciate you more. This gives the therapist a better understanding on what the patient is trying to say, and it can help strengthen the relationship in the long run. Another element that is focused on in this chapter is making the patient be more sociable. Patients that have never been to therapy or have never been to a cognitive therapist might not know that there is activities and homework for them to do. It is the therapist's job to inform the client of all of the tasks and requirements that are going to happen in the session. The homework can help the patient become more confident and could have them be more social in environments that they might not be familiar or comfortable with. The patient should be encouraged to express their mood, report their previous week, and help set the agenda they want to have so the sessions can go better. The therapist should inform the patient that their feedback is important and it will help the sessions get deeper. Collaborating the tasks for homework can help the patient gain social skills and gain trust with the therapist. The therapist should take notes and refer to those notes so that they can give information to their patient. The notes can include the homework that is or was assigned and the events that were talked about in therapy. These things can help the patient get to know your style and get to know you on another level. This can also have the patient gain skills for problem solving and for social interactions. If the patient feels comfortable and safe, then the relationship can be stronger. Since the patient is unfamiliar with all of the requirements, it is important for the therapist to be nice, thoughtful, and willing to work with a client on anything that they do not understand and help them have an experience that will benefit their life and their therapy session. Another element that should be taken into consideration is engaging the patient. This could be a problem when the patient does not believe in themselves and does not commit to changing and doing things that can benefit them for the treatment. The patient might also have unrealistic hopes and dreams that they want to accomplish. The patient might not want to change themselves, but they expect results. The patient might also worry about their future if they change their behaviors and actions. The patient might not want to make that and take that responsibility for the actions. They might feel hopeless about the whole situation. The patient might not want to change because they will have to involve themselves in something that is uncomfortable for them. Getting the patient out of their comfort zone and into a healing process is very important. The therapist should be aware of the signs that are shown while in the session. The therapist should also reassure the patient that they will work together and that they will do whatever is needed to help the patient. Lastly, the elements that should be done in a therapy session to help improve the structuring and the relationship between the patient and the therapist is to have a brief update and a final summary. These ideas from the patient can make the session better in the long run. It can make the session go a way that makes the patient feel like they have power and control of their feelings and their journey. It is important for the patient to recognize their improvements and the process that they are going through. It is important for the patient to feel like they have seen and experienced results. Before the end of the sessions, the therapist should ask the patient if the patient wants to work on specific topics or if they want to continue talking about what they have been talking about the entire session. The patient and therapist should be mindful of time, and the therapist should let the patient know towards the end of the session that they are close to the end. Then, the therapist and patient can talk about the same topic, address a new topic, go back to a previous topic that was not resolved, discuss homework, or work on planning next week's agenda. The therapist has to deal with these problems in therapy and has to be okay with structuring the session to meet the patient's needs. These are the main points for Chapter 8 and the problems that are involved with structuring the therapy session.